Good morning and afternoon, everybody. Sorry for the delay in posting this, but we had some issues with our recording. But we're going to go from here. So, we're covering headache relief. We're going to kind of cover this a little fast just because we don't have anybody here to ask any questions or anybody online. So, headaches are the most common disorder of the nervous system. Now, estimated from what the slide has listed as 47 to 50% of adult population experience headaches regularly. Now, there are over 35 different types of headaches. We're just going to cover a few of them. The big three we'll show you in just a few slides. Chiropractic care for these offers natural and non-invasive approach to manage or prevent headaches. We're going to cover the top three that most people come in with, at least for chiropractors. In this presentation, we explore, as it says, types of headaches and how chiropractic can help. Now, these top row and then the middle row, these mostly are from external sources, not necessarily meaning of disease or any issue that cause the headaches. But this first one, migraine, can be a multitude of things. It can be hormonal, it can be sleeping on your bed wrong. There's just a lot of things. And then we'll cover what migraine symptoms are later. Tension headache. This one kind of feels like a rubber band wrapped around your head, just a tight muscle going all over the lower portion of your scalp. So kind of up around your ears and around your forehead. Hormone headaches primarily are female patients come in with these. Unfortunately, if you have a hormone imbalance, this can be an issue. Exertion, this is primarily from being outside or overworking yourself. Cluster headaches, they come from behind the eyeball or around the eye and cause some visual issues. Allergy and sinus, we see these about twice a year when the seasons change, so when the pollen's out or high quantities. Caffeine headaches are usually when somebody has stopped drinking as much caffeine as they have previously, either cold turkey or slowly going down, and then they get a little bit of a headache. Now, rebound headaches, this one is kind of when a previous headache or migraine has subsided, but then your body kind of rebounds and you get a secondary headache. It may not be as bad, it may be worse, just all depends on the person. Now, these lower two rows, these are primarily from disease type, except for TMJ, or traumatic, as this one is. So hypertension, when you have elevated blood pressure, it can cause headaches. Post-traumatic whiplash is the big one. TMJ, I have a little click in my jaw, so when I chew too much on big food, I do get a slight headache. Thunderclap and ice pick. Now, these two are on here primarily because they are an emergency type of situation. These can be like a stroke type of headache. So thunderclap, it just comes on suddenly and it's very, very painful. It's the worst headache you've ever had in your life. And so this would be something you'd have to go to the emergency room for if you were to come here and a chiropractor wasn't paying attention very well. They might think of it as just a regular migraine, but there are a little bit of differences. And we would have to refer you out to an emergency room to be further evaluated. So the first two that chiropractors see most common are tension and cervicogenic headaches. Now, tension headaches are caused by stress, poor posture, muscle tension in the neck, scalp. There's a lot of these are muscle and posture related. So when you're sitting forward at your computer, head down, looking at your phone or reading, and you start getting a headache, it's mostly due to you being forward and the muscles are being tension, and you need to relax them. Heat, like a warm shower, hot pad or something, just to loosen those muscles up. And the symptoms are dull, achy head, tightness around the forehead, tenderness around the scalp, kind of like a rubber bands around your head. Now, cervicogenic headaches, they originate from issues in the cervical spine, so in your neck. They're caused by posture problems again, that's a big one, cervical joint dysfunction or injury, and then pain on mostly one side of the head, stiff neck, reduced neck mobility, pain-triggered neck movement. A lot of these can be helped by a chiropractor. Now, the migraine headache, this one is a lot more intense. They are very different from a regular headache and can typically occur recurrently. So it happens more often than just a regular headache, or happens periodically, once a month, twice a month, that kind of thing. caused by obviously hormonal changes, stress, sensory. So hormone changes and diet are the big ones that we hear about when it comes to migraines. Diet, soy is a big one. So if you cut out soy, processed sugars can cause migraine, as well as gluten can cause headache, migraine in people with gluten intolerance. Symptoms are throbbing pain, nausea, vomiting, light sensitivity, sound, visual disturbances. Everything that is around you causes you physical pain, and you just get so uncomfortable. You get nauseous, vomiting, all that. So, an adjustment of the neck can be beneficial, but then also a little bit of hydration, um, proper nutrition, that kind of stuff can also minimize these. Now, here's how chiropractors come in. We alleviate symptoms, not necessarily looking for uh, the root causes, what medication does. Sorry, I misspoke on that one. Chiropractic focuses on the root cause to try and alleviate, as well as stop any further instances. Now, spinal adjustments restore proper alignment of the spine, particularly the cervical spine. That's where a lot of headaches come from. Now, we improve posture. That's where a lot of these posture-related headaches, so the cervicogenic, the tension, and a couple other ones originate. Relaxing those tight muscles enhance nervous system function. Now, that is a big one. When we do the adjustment and you hear the pop or click, or we get better movement, that just means the nerve is no longer compressed. It no longer has something going, decreasing the area in which it originates from your spine. All of this reduces muscle tension and stress, so it can relax the muscles, it can help everything move and feel better. Now, the next portion, self-care headache prevention. Big one is stay hydrated. A lot of people think they drink enough water. There we go. But really, they need to drink at least their body weight in fluid ounces a day. If you're active, if you're in sports, if you're in some sort of athletic event, you need lots of water. If you're just every day, not really overexerting yourself, about half your body weight in water would be great for all the processes that go on in your body. Managing stress, techniques like yoga, meditation, deep breathing. Now, deep breathing is not quick breathing. Deep breathing is you breathe into your stomach, you breathe into your belly, you watch your belly expand outward, and then you slowly breathe it out. That's deep breathing. So nice big. It helps stimulate your body's parasympathetic to calm you down. Maintaining good posture, avoiding slouching and hunching over is a great benefit. It decreases a lot of pain and discomfort. And also in this, creating a constant sleep routine. So as best you can, go to bed every night at the same time. Don't watch TV, or if you do have a screen on, switch it to like a red or an orange mode, so that the blue light, where a lot of people get that stimulation from, so they stay awake longer. If you get to an orange or red light, that's more of a calming effect and allows you to sleep or fall asleep. Stretch regularly, those are really good. Avoiding any known food triggers, alcohol, processed food, and soy, excessive screen time, that kind of thing, like I just said. Finally, this one I want to cover, take a minute or two on. So, stroke versus headache. Headache are usually caused by, as it says in the slide, factors like muscle tension, dehydration, or nerve irritation. Stroke is caused by blockage or rupture of blood vessels in the brain. Very different causes. Onset, headaches can be gradual or sudden. Strokes can also be sudden, but there are very distinct differences. There's no neurological issues when it comes to a headache. Now, a headache, when you have, like, you can't look at stuff, you have overstimulation hearing, that's not the same thing. Strokes, when you have an accompanying symptom like muscle weakness, arm weakness, leg weakness, vision difficulties, like double vision, that can also be a migraine, but they also have these other issues that accompany it. So while a headache can be debilitating, they are not life-threatening. Strokes are a medical emergency. They need to be taken to emergency room as soon as possible. One, to prevent brain damage or brain death, and potentially saving the person's life. Now, strokes additionally involve neurological symptoms. So this is where we're going to talk about, you need to get them to the emergency room fast. So we have fast as FAST. F is face. Look for face drooping, or A as in asymmetry, so both sides of the face are not doing the same thing. Speech difficulties, so they aren't able to say S's, they're slurring their words. Those three things lead to time. You have a short amount of time to get them somewhere to help them prevent any damage or any issues. And one other caveat is that when you talk to somebody who's had a stroke, they don't know what time it is. So if they have a watch, they have the time. They don't know either where they are, what time it is, or certain numbers. So if they ask you multiple times in a row, what time is it? Please check on them. So if they say, hey, what time is it? And you're like, it's 1:30. And then 2-3 seconds later, like, what time is it? And they're like, it's 1:30. Are you okay? Because you don't know if they're like playing with you or if they actually have an issue. So please keep an eye on that. So FAST, if they have issues with time. Headaches can cause discomfort, but they don't accompany neurological issues. Thank you. Sorry, we flew through that pretty quickly. If you guys have any questions or concerns on any of those, feel free to call, text, email us, and then let us know if you have any subjects you want us to cover in spinal workshops in the future.